Hello, Andrea. Thank you for taking a few minutes to speak with us today about your experiences with this migraine and then the migraine surgery that you had. I'd like to start by asking you just a little bit about what your headaches were like before you first met me.
More than headaches is the first thing I think of. They were, I would describe it as being hit in the back of the head with a bat, and then would follow with pain down my arm, down my back, in my right jaw, in my ear. It impacted my life completely by the time I saw you.
Okay. And how bad, on a scale of 1 to 10, would you say the pain was when it was bad?
By the time I saw you, they were 6 to 8 every day.
Okay.
Every day.
And how long would that last? Was it all day long, or would there be a little bit of time where you didn't have pain?
I would never be at a pain level of 0. I would be at a low pain level, but it would almost always come at some point of the day, whether it would be when I was getting up and moving around quickly, or sometimes it would be when I woke up in the morning.
Okay.
It just depended on the day.
All right. And so when you came to see me, we first treated you with a little bit of Botox to try and see if we could address or figure out which nerves were causing your pain. Tell us a little bit about your results with that.
Well, when I came in, you said this is kind of a diagnostic tool. And at that point, I just was ready to try anything. I was the person that was watching Mystery Diagnosis, waiting for this, something or someone to know what I had. And so you said to try the Botox, and having it injected was simple, easy, quick. And then I think it was about 2 weeks on the dot that the pain level went from 6s to 8s every day to like 2s and 3s every day.
Right.
And
so based on the results of that, we did an operation to decompress a nerve in the back of your neck. Tell us a little bit about your experience with surgery. What was that like?
It was great. First to kind of back up, when I came in and you said, okay, the Botox is working, we can either try more Botox or do surgery, and one of the things that you did say was, here's how many I've done, or we can try doing more Botox. And I just felt like I trusted that you were honest from the beginning. You from the beginning always knew what symptoms I had before I even said them, and I never saw a doctor once that did that for me. That, my point being, that's what made me decide to do the surgery. And because I had always waited for this moment of, yes, this is it, and this is what's going to fix it. And surgery was wonderful. Other than the vanity part and having to shave a little bit of hair off, I had lots to cover it, and no one even knew that my hair was missing for a short period of time.
Did you have a lot of pain with surgery or nausea?
The nausea, not really. Pain, yes, but not. I had been so used to pain that it was about equivalent to what I'd been having on my worst days.
Okay.
And I found, actually, with the surgery that ice worked so well. The 2 times I've even had a little bit of a headache since then, I've used ice and it works right away. So that was a nice learning tool for me at the time. And then the pain went away within a few weeks, literally. And then the days of having any pain at all came quickly thereafter, having days of no pain.
Okay. And so now you're about 15 months after surgery, and what are your headaches like now?
I say non-existent. because they really are. I can't remember the last time I took Advil or Tylenol. I don't take any migraine medications. I literally have had 2 times over the past 15 months where I had quite a bit of pain, and it was both times were induced by me lifting something heavy, just aggravating those muscles. But I can't remember the last time I even had a little headache. They're very faint, very very easy to deal with.
And then you actually have a little package here.
Yeah.
That I think you had mentioned you were done having children prior to first seeing you, and then how old is this little lady?
8 weeks. This is Selena, and yeah, I truly thought I was done because I thought that I couldn't possibly try and take care of another child with the pain that I was in, and all the doctors I kept trying to see. I kept trying to see so many different people to figure it out, that I just thought, okay, this is it, and I wanted more.
Right.
And then I got all my steam back. I got my, sounds corny, but will to live. I really am ready to kind of attack the rest of my life now, as opposed to kind of dreading the rest, in terms of, I think I'm going to be a better mom, better wife, everything, because I'm just happier. When you're in pain, it just, everybody thought I was depressed. Sure, I was depressed. I was in pain every day, but now I'm really ready to attack everything.
Well, thank you for taking the time to speak with us. Really appreciate it.
Thank you.